Hi, this is Adam Sandman from Inflectra. Welcome to our webinar on testing in the healthcare and life science industry. In today's webinar, we're going to first of all outline the needs of the healthcare industry. We'll then look at the Inflectra platform and how it has unique capabilities in the healthcare industry and for life sciences. We'll then do a deep dive into the live application where we'll show you how you can manage your testing, verification, and compliance using SPiraTeam. After that, we'll then show you how you can use our automated testing tool, Rapise, to enhance your automation of testing to validate systems repeatedly and more quickly and reliably. And then after that, we have a Q&A. So first of all, let's talk about some challenges in the healthcare industry. So there are lots of things going on all the time, but here are some of the key things that I think are driving the changes and challenges for people in the IT industry working in healthcare. First of all, government regulations. These are part of the healthcare environment, and they always have been. However, of late, there's been increased attention to data privacy, partly because of some of the data breaches we've seen, and also because of the general data protection regulation going on in Europe right now, which is making data privacy come to the fore. And of course, the Facebook situation, again, making people realize that data is an asset, and that if you don't have legislation and rules governing privacy, companies won't necessarily take it seriously. Healthcare has already been ahead of the curve with this with HIPAA, which has been around for many, many years. But even so, the penalties for not understanding data privacy are critical, and it challenges everything around testing, as we'll see a little bit later on. Also, rules in the medical industry around compliance and regulations for the Affordable Care Act and its successors. And then traditionally, with even beyond that, things like the CPR Part 11, federal FDA testing you'll do for medical devices, being able to manage billing and insurance requirements for Medicare, Medicaid, or private insurers. Lots of challenges there around managing data, managing information, and systems being used in the healthcare setting and healthcare context have to be tested and validated and proved to regulators, whether it's a medical device being proved for the FDA or a billing system that's being implemented that has to basically bill various government agencies. Compounding these challenges is the fact that at the same time you've got consolidation vertically and horizontally in the healthcare space, with healthcare prescription providers acquiring medical networks and healthcare plans consolidating, and individual hospital providers are also consolidating, partly because of the complexity of the Affordable Care Act and other legislation. Independent doctors are now becoming part of larger and larger healthcare systems. And when you integrate these healthcare systems, all the IT that goes with that, the patient records, the billing, the insurance history, all of those different systems have to be integrated together. And if you go back to that first bullet about government regulations, you can't just integrate these things and hope they work. You have to prove the integration has worked, that the data integrity has been maintained, so that you can still comply with those regulations both after the consolidation and how it compares to the same data prior to the consolidation. Also, the systems themselves are becoming more complicated. You have billing and pharmacy systems, blood bank. You now have electronic patient records, which may have been previously on paper. You also have patient information systems and wellness programs running within hospital and outpatient centers, providing information, medical information, and entertainment even. All these systems have to tie together and all have to be validated to work in the hospital setting. And then lastly, unfortunately, this is happening at the same time as there's an imperative to cut costs, partly because of reimbursement rates are dropping and also because of some of the changes in the industry because of the ACA and Medicare and Medicaid. You are getting a cost-cutting imperative at the same time as there's more work to be done in the IT infrastructure. So these are some of the big challenges that we're seeing. Some specific things we're also seeing on the IT side of things would be that systems have to be validated. Now, this is something that's been around for all time. You have the CPR Part 11 for medical devices and medical systems. You also have rules for hospitals and information systems as well. However, we are trying to be more agile, and agile development is reducing the risk in terms of the conceptual risk of developing a system that doesn't meet the needs of the end user, because you can actually get feedback prior to its delivery. That's the great thing about Agile. Unfortunately, Agile also means you don't have as much time to test at the end. You have continuous development, continuous deployment, which we'll get to next, and also continuous testing. And how do you test something when its features are changing rapidly? How do you do a requirements traceability matrix when the features are constantly changing and iterating. So these are some of the challenges agile development particularly presents in the medical sphere and the life science sphere. And then obviously cloud computing is also a challenge. Now, first of all, there's a data security challenge, there's a privacy challenge that goes with cloud computing. In the context of this presentation, we're looking really more at the testing and validation side of things. Challenges there also. If Microsoft Azure is updated, or AWS potentially every month, the Windows images, the Linux images are being updated every month, or more frequently than that even. There's bug fixes, hot fixes, security fixes. Whereas before you had a stable environment that you could build a validation and test plan around, you've got this continuous upgrading, continuous need to validate these systems. So the tools that you would have used, I think, to do the testing, the requirements analysis, the reporting, that we would have worked in a more traditional, we're going to upgrade every 6 months, we're going to maintain this version, we're going to validate it, test it, deploy it, and be done. 6 months later, we're going to come back. That's out the window. You don't have that luxury anymore. So you need tools that can do continuous testing, continuous development, continuous deployment, but continuous validation and continuous compliance. So that's the problem space. So that's quite a daunting challenge. So how do we help? And we at Inflectra, we pride ourselves on providing tools to help you automate your process, improve testing, improve quality, and reduce risk. And how we do that? We do that with our suite of tools. Today we're going to be focusing on a couple of them, but this is our entire product suite. And it covers the entire life cycle from an idea being thought of to it being turned into requirements, to being turned into working production code, to being tested, deployed, and with our current desk IT support system, being put in production and feedback coming back into the system from that feedback. So managing the life cycle of a system or set of systems is something we've been doing for the past 12 years, and we believe very strongly that having the right tools can make it much easier. Having the right tools by themselves isn't going to be a silver bullet. You have to have the right processes, the right culture. A lot of different things have to come together. We want to give you the tools and some of the best practices to do that, but ultimately you have to put it into a process with a team that's going to make it work. And for today, we're going to be focusing primarily on our SPiraTeam application lifecycle management tool. And at the end, we'll talk a little bit about test automation with our Rapise automation platform. So we're going to be going through an actual live application demo, but before we do that, some of the things we're going to talk about in the demo. One is requirements development and requirements validation. We believe it's really important that when you write requirements, you have a way of validating and testing them, and it's real time. You don't have a whole bunch of requirements that you give someone to test, and then you have to go back and verify them and manually connect everything. And as things go into production and go into potentially a cloud environment, upgrading constantly, you're having this real-time feedback. As things fail, as things aren't ready, you don't have to go looking in multiple places and try and pull that information together. And part of that way we do that is through our requirements traceability. We believe that the requirement is the key cornerstone of information. We want to tie things like the code, the tasks, the test cases, all the pieces of information that describe how that requirement has been developed, how it's been tested. That all needs to come together in one place where you can see the information in real time. Another really important piece, particularly in life sciences, but it's true in any regulated industry, is the audit and logging trail. So first of all, any change that's made needs to be logged. We need to understand not just what the change was, who made the change, why it was made, when it was changed, and if it's an important change that requires someone to sign that change, making sure that the change has been prevented from being tampered with, and we call that a sign change. We'll talk about that a little bit later on, but that's about how you ensure that there is auditability and that the data is integral. There's integrity of the data in the system, because otherwise the validation is meaningless. Another really important part about validation and testing is going to be controlled access, because if you're going to certify the system has been tested, these requirements have been met, you need to make sure that you know who's logged in to perform every change. Obviously, the history log helps, because if someone who was not supposed to be given access does get access and makes a change, you do have an audit trail. You can see they made the change. However, you do want to prevent that as much as possible with controlled access, and so that you have the right people in the right roles. And that also ties into the fact that when you start to approve items in the system, you need to make sure that the person who wrote the requirement may not be the person who's supposed to approve it. You need to make sure that that's all controlled in the system, so that the person with the right role can only perform the task they're supposed to perform according to your process. It's also important that when you configure any system, whether it's ours or another tool, you need to make sure that when you document your process, you configure the system to actually match that. Having a process that says one thing and a system that works in a different way doesn't make any sense. That wouldn't be an auditable, system and process. It has to be tied together. Some specific features that we do have for life sciences in particular would be the ability to have workflows and integrated electronic signatures. Workflow means you can take a new idea, a new requirement, or a test case, and you can review it, you can approve it, and then put it into production ready for use. But also at certain key points before it goes into production, you need to make sure that a test case and that requirement have been signed off on. And then after the testing is done, you'll need to have a signature done potentially to review the test results independently after the test has done their job. Depending on exactly where you work, if you're in a life science situation, testing a medical device, you may have one set of processes. If you're working in a hospital, testing an electronic patient system, that's kind of another set of rules and processes. If you're doing a billing system or insurance, again, another set may be in play. So it's important that the process that you build with the workflow and the signatures match the exact way you need to do testing and validation. Another thing we want to talk about today, which we'll show you, is automation. And automation can be a great tool if it's used appropriately and judiciously. So automation will let you automate the validation and testing of certain systems. And some systems are more automation friendly than others, and also certain tools can automate different applications better than others. So depending on what applications you are actually going to be testing and validating, you will potentially have a range of automation tools that are available to you. And it may not be the same tool for different systems. So a tool that works very well on maybe a web or mobile application may not work so well on a complex, desktop application or a mainframe application if you still have some of those. So having the right tools that can handle your application is important. And it's not a problem. You can have different automation tools for different technologies. As long as they can report back in a centralized way, you don't have to have one automation tool that necessarily does everything. Another thing that can be useful is even when an automation tool can't truly automate the application, you can use it to automatically document the application. So instead of writing test cases by hand, maybe it makes sense to use the automation tool to build your test case for you based on the application. And as I mentioned at the beginning, as you start to look at agile methodologies and approaches, you don't necessarily have an application that's been designed and developed, ready for testing and then deployed. You may have a feature that's in its conceptual phase. There's some idea of what it's going to look like. You can build a test for it, but by the time you actually get around to the next iteration or sprint, the feature has changed substantially based on feedback and potentially isn't the same test. So you need a way to generate test cases more quickly. Even if they can't be automated to actually run, you can at least automate the creation of them. So that's an overview of the context of what we're looking at. And just to sort of recap before we get into the application, what we're trying to do here is put together a platform where we can write requirements, we can manage the testing and validation of those requirements. We can do both manual and automated testing of them, and we can have an integrated set of reports and tools to generate documentation. So if you need to generate compliance documentation or audit documentation, you don't have to do it all on paper. You can use a system to run everything and then generate the documentation from that. And with that, we're going to launch into the live application. And so this is SPiraTeam. This is our requirements and test management solution, and it manages your entire life cycle from requirements through to testing. It includes defect tracking and task management. It also can integrate with other tools. So if you have projects using other tools to do defect tracking, you can integrate different tools on different projects. And for today's discussion, we're not necessarily going to focus on all the features of SPiraTeam. We're going to focus on the requirements in testing and compliance functionality. And so first of all, in any project, you want to make sure you understand what are the different requirements you're going to capture. So let's go into requirements to start with. The requirements in your project, they would need to be defined and developed. Now, depending on your project, you may have a requirements matrix that looks something like this. You have a series of features that you've spent some time developing. They could be functional requirements. The system must do X, Y, and Z. That's the functionality. Now, obviously, there are constraints in the real world as well. So as well as functional requirements, you may also have, if I expand my screen, I can show you some other ones. You may also have some what we would call system constraints, things like the illities. For example, what is the reliability of the system? Does it have to have 3 nines? Does it have to have 5 nines? What is the uptime? Scalability. Are we talking about a consumer health portal that has to have 100,000 people sign up at one go? Or are we talking an inpatient system with a relatively small number of users that is well understood and isn't going to grow exponentially? And the usage is pretty limited. Things like that. So those are some of the qualities. Another tool we can have is called a use case. A use case is not typically used as much in Agile, but it's useful when you have a more complex process and you want to define all the steps. So whereas a traditional requirement or user story is more textual, for example, this requirement right here, where you have one where it's going to be some text describing what the functionality needs to be, something like this. A use case is going to give you a more of a process flow where you can actually go into the system and you can see the steps like that. So those are kind of different ways you can define your requirements. The key will be, though, when you've written your requirements, you need to be able to generate the test cases for that. And so what we'll do for right now is we'll go in and create a new project and we'll actually simulate how that you'd set one up. So if you can imagine, we've got a new healthcare project. Let's go in and create one. So healthcare validation project like that. And you can put it into a group. We're going to create that. And what we're going to do is enter some requirements. So we'll choose our healthcare validation project right here. And we'll add some users to it. And as I mentioned in the slide, an important part will be to define your user community, who's writing the requirements, who's reviewing them, who's writing the test cases, and making sure that those users have the appropriate role and the appropriate permissions as described in your plan. So we'll make one a test and one a manager. Okay, and now that we've added them to the project, what we'll typically want to do is then go in and do requirements generation. And so requirements can be manually entered. They can be entered from a spreadsheet. So in the case of SPiraTeam, we have migration tools that let you bring in test cases, requirements from Word and Excel, Google Sheets. Other tools you may be looking at or may want to consider may have other options depending on what the data is today. So it's important to understand where will you get your requirements from. Are they new? You're going to write them in the tool, or are they something where you have to get them from an external source? So we'll talk about, so let's say we have a patient information system. Okay, so that's going to be our top level requirement. And under that, we're going to create a child requirement. And let's say we're going to basically have the ability to enter patient demographic data, name, age, those kinds of things. And then maybe we're also going to have the ability to load in patient health records. So perhaps it's from an external system. That could be one of the requirements. We might want to define what those requirements would be. For example, what format is that data coming in, that kind of thing. And then as well as those functional requirements, maybe we have something else around privacy, because obviously it's HIPAA, we have to be careful. So maybe we need a way of obscuring some of the information. So maybe a feature would be, if I put that under privacy, we'll create a new child requirement, we'll call that so health records need to be encrypted in the database. And that would be an example of a non-functional requirement database. Okay, so we've now got some requirements in the system. Again, this is a very simple example. In real life, we might have many thousands of requirements. So we have to be able to test these and prove we've tested them and prove the data is good. And so the other thing we may want to do is also have these requirements be verified, because these are right now our requirements. They've come into the system. We haven't yet done any of the validation. We haven't approved these yet. They've not been tested. There is a question that came in. For those who joined late, for this webinar, we're going to be doing the questions and answers at the end. And so if you've written a question into the chat window, well, that's great. Please feel free to do that. We will review them at the end of the presentation, so don't worry. So just to go back, we've got some requirements. One of the things we might want to do is go into the workflow, for example, And we might want to modify that before we actually put this stuff in and actually have it so that as the requirements get entered, we actually have an approval cycle. So if we go in, these are all new requirements that came in, they're all marked as requested. We now have the ability to approve them or perhaps reject them. So let's say when they are accepted, we want a signature for that. So we'll turn on the ability of electronic signatures. The other thing we want to do is make sure that the right roles can approve them. So right now I have the project manager and the manager. That sounds good. You could also have it so that you can assign an individual person, and that person, the requirement with the requirements assigned to, only they can do it. So you could do this. That would make it much more specific. Only the person you assign it to can approve it. So depending on your process and your business and exactly what your validation process will be and your testing plan, you will want to configure this part of the system to make sure it matches. And we have some blogs on our website which give some best practices for different types of project. So I'm going to leave those both on. I'll turn that back off, but I will keep the signature turned on. Hit save. Okay, so now if we go back into our requirements view with that enabled, if I go into the requirement, let's say I'm going to approve this one first of all. So I go and I accept it. When I accept it, you'll notice that there's a padlock. That means that I will have to sign the change. And it's also made the priority mandatory. So you can describe different fields in your review cycle that become mandatory. So let's go in and say, yeah, that's good. Looks good to me. It's got a name. It's got the priority. There's no description, so we'll put a description in. User, the patient, data includes. You can make these sub-requirements, or you can just make them part of this requirement using, say, a bulleted list. That's up to you. So name, SSN, maybe we don't want SSN, date of birth. And for example, this would be the data that you want to capture. Hit save. So I'm approving that. And I have to re-authenticate to make sure it's truly me. That's the meaning of what I'm doing. You could edit the meaning. In this case, it's good. And so my requirement has now been approved. So I have an approved requirement. That's excellent. If I go into my test coverage column, there are no test cases yet to validate this. We're going to come back to that in just a second. But if I do go to the History tab, you will see that I do have a set of changes that have been made, including the description and the status change. If I control-click on Admin View, you'll see these are the changes. You'll notice that this one at the top is marked as valid. That's because the electronic signature was applied to it. It's comparing a hash of the data with the current data, so that way if someone tampers with it, this signature will go red, and you can find it by looking for the invalid signatures. So SPiraTeam in particular does provide functionality for making sure that all the changes that you want to be signed are signed and they haven't been changed in any way. So there's integrity. Okay, we're going to go back to our requirement. Now, we haven't written any test cases yet, so we'll go ahead and do that. So we'll go into the testing tab and we're going to create some test cases. So we'll go in here and you can put folders for your test cases. We will have some, so let's say some functional, or maybe let's say some manual tests. We'll do some automated tests later. So we'll do manual tests, and maybe we'll do some automated tests. So let's do manual first. So let's go here. We'll create a new test case. This will be to test the patient data can be entered. Something like that. We'll go back and we'll go to our requirements coverage. And we'll go add that requirement, and it's under patient information system, and it's enter patient demographic data, and that's good. Hit save. Now they're linked, so we now have a test that verifies that functionality, and we will go down here and add the steps. There's one step created by default. If you don't want that available, that you can always turn that feature off so it doesn't do that. And so let's just say, user and goes to new patient page. The expected result is the page the form is displayed. Another step, which would be enter the name, date of birth, and SSN for the new patient. And the expected result would be the data is displayed or is accepted. The SSN is partially obscured during entry, for example. Maybe that's what you want, maybe not. But that's the example where you could actually describe in more detail exactly what you expect to happen. And the more detail you give, obviously the better it's going to be, knowing that maybe the application isn't yet finalized. and you can then approve your test case. Now, we haven't turned on signatures for the test cases. Just to save time, I'm not going to go into the workflow and do that. But in real life, you could go in here and you could actually have an electronic signature, so there will be a padlock here for the approval of the test case, and then we can have an approval, just like we had for requirements. That's up to you if you want to do that. So let's say, requirement, a test case approved. Okay, so we've now got an approved test case. Great. We've got linked to an approved requirement. So that's excellent. If we go back to the requirement, one feature we do have is now you could, for example, in the workflow, lock some of the fields so that when this requirement is actually ready to testing and reviewed, becomes read-only. You can do that in the workflow. If you don't do that for some reason, we do have another feature which is helpful, which is if someone was to change the requirement, like that, and this is the test it's linked to, when we go back to the test case, it automatically flags the suspect flag right here. And that's really important because that will warn you that you've got a test case now that's suspect, because the requirement has changed since the test case was approved. And the reason we do that is it's very easy then to find them, because you can go into the test case view and simply say, find me all the test cases that are suspect. So you show the column, apply the filter, and there it is. And if we go to the root, you'll see there's only one test case because there's obviously only one right now, but it matches. Okay, so that's an important feature there where you can actually verify that the test case is still accurately testing the requirement, because if the requirement has changed, the test case would need to be edited. And let's say the change was minor, it was the number 2. I can go in here and review that and say, have reviewed, and test case still good, for example. So I'm undersetting the suspect flag, which you'll see in the history, and I've given the reason why. So we now have a test case that's ready. We now have a requirement that's good. If we go back to our planning requirements view just for a second, you'll see we now have one test case listed with the gray bar. Gray bar means not run, as opposed to not covered, meaning there's no test case. We can't test this. And the graph here will show you what is the ratio of test requirements. Do they all have test cases? Do none of them have test cases? Have they been run or not? And so the blue means there's no test cases, and the gray means there are test cases but not yet run. We're going to run it in a minute, so you'll see that status change. Just to have more than one test case so we can see what's going on, I'm going to create a second test case for this second one that's loading in the patient health records. One feature we do have to save time is I can go in here and say create test case from requirement. That will automatically create the test case, and if there is a description, it will include that, there wasn't one, into the test case. And you can go in here and describe this. So we'll say tests the loading of the patient records. And we'll save that. Someone just mentioned there was a problem with the audio. They're not on the audio, so I'm just going to send a quick message to them, so please bear with me. While I do that, you need to click the... Okay, so back. So we've now got our requirement, we've got our test cases, we've got 2 test cases. So if we go back to requirements before we go any further, you'll now see we've got 2 gray bars. One is, because this one is the patient demographic data is one test case, the loading in the patient record from some other system is a second test case. Both are not run, both are listed as gray. Okay, good. So the next thing we need to do now is run the test cases. So what we'll do is we'll go to test sets. Test sets are our way of grouping test cases together and assigning them. So let's add a folder for our test set. We'll call it initial testing activities. And we'll create a set, and it will be test cycle 1, like that. That's great. And now we've got a test cycle 1 written. What we want to do is put our test cases in there. So we'll go in here, we'll add the test case, and we'll go to manual tests. We'll choose the test case, hit, that's fine. Well, then we want to add the other one, which was the other one, which is in the root, I believe, loading in the data. So we'll add that. Great. So we now have 2 test cases. Test that the data can be entered, and test the loading of the patient record. Okay. Now the second one, if you look closely, that the icon is slightly different. We don't yet have any steps written. I forgot to do that. So I'm just going to go in here and quickly add a step to it, which will be, upload the patient record XML file and verify the data. The data is correctly loaded. Now in real life that would be far too much to do. You need to have several steps to define what you mean by correctly loaded and validate the data and all the rest of it. So again, just a simple example, but you get the idea. You'd want to have a description of not only what the activity was, but how do you prove that's the case? And just saying the data is correctly loaded probably isn't going to cut it in real life. You may have to have several validation steps to make sure that the data that you loaded in truly does meet the original. And maybe that's an automated test where you're going to loop through the Excel sheet, loop through the system, and do a side-by-side comparison. That's actually a really good example of where automated testing could really help. So we've now got our test cases. So let's go ahead and let's go and run them manually. So let's just say we're going to go run this test set. And next. And so let's go here. Perfect. Here are our steps. So the first thing we have to do is go to the patient page. We'll pass that one. And the second one is we have to enter the name and the social security number. And let's pretend that failed. So we see a failed. The SSN was visible. So I could enter the data, but one of the pieces perhaps didn't work correctly. And so that's a failure. And I might want to put some evidence in for the failure, so I'll just put a screenshot in. I'm doing my current screen. In real life, you'd want the system that we're testing. And the next thing we want to do is log a defect, so we can have someone fix that. So we'll log a defect. So we'll say bug on patient entry screen, SSN visible. Bug. That's pretty high. Say critical. Say hi, yeah, hi is good, and we'll hit fail. So we've now failed that. Oh, I need to have a detected release. I forgot to set something up. My mistake. One of the things that we do have in SPiraTeam that's really important are what are called releases, and these are important because you have to actually keep track of your testing results. And it's important to do that because otherwise results that you ran one time may fail in the next release. And how will you know what version you have and what's passed and what's failed? And you always will have at least, however good a system is, you're always going to have multiple versions and updates because as you find things. So it's really important that you do create different releases. We recommend creating at least one release, even if you think you may not need it, because otherwise in the future you're going to have a hard time distinguishing what functionality failed in which version. And we're actually going to be adding more functionality in the future around baselining, which will build on top of that functionality. So using releases is a really important thing, and we definitely recommend you do that. So I'm just going to go back one step, and I'm going to my test set, and I'm going to go in here, and I'm going to assign it to a release, version 1, and I'm going to run it again. I'm just going to repeat that with the release this time. So the release is now set. Hit next. I'll pass this one. Failed. The SSN was visible. It should be obscured. Do my screenshot, and I'll go back to my defect. Bug on the screen. SSN should not be visible. Visible. Okay, and I hit fail this time, and there we go. It's now failed step, and the whole test case has failed. The next one was loading in the data. Let's say this doesn't make sense. I can't do this by hand. It's way too complicated. So I'll put this as blocked. Cannot complete. Would take 2 months to do by hand. So maybe we're going to automate this. So we'll put a note in there. So we've passed one test, one step of a case, failed it, and the next one we just said blocked. We can't do this. It's going to take us too long. Okay, so let's go and hit finish. And now if you go back, what you'll see is we have a test set with 2 test cases. One is failed, one is blocked. If you go to our requirements page, you'll see the same thing. One requirement had a test that failed, one requirement had a test that blocked. The overall status of the parent patient information system is now 2 tests run, 1 blocked, 1 failed. For the project as a whole, you'll also see that we have that privacy encryption. We're not doing any checks that the encryption is being done. Maybe it's not being done. That's a test we should write. So even non-functional requirements should really have a test, and that could be an automated test that the data is encrypted, or maybe it's just having someone, maybe just verify that at least it's not in clear. That depends on, again, what your validation plan is. But the blue here is indicating we have at least one requirement that's not yet testable. Okay, so before we get into the automation piece of things, reporting is a critical thing. As I mentioned before, you want to use a tool like SPiraTeam to manage your requirements, your test cases, your plans, being able to have all that being managed electronically in real time. And if you think about it, on a much larger project, we could have tests being run all the time, all the results are coming in. I have this real-time view, and if I go to my project dashboard, I can even see that in real time. I'll go to the project, I'll choose my testing view, and here you can see my requirements coverage, which again, only 3 requirements, failed, blocked, and not run. We saw that on that little pie chart. You can see the test results over time. You can see your test case status also, and you can see it by version. So if you're looking at release 1, you'd realize, yep, 1 has failed, 1's blocked. We've got some work to do. Similarly for the requirements, we've got one test that's failed. We've got to fix that. 1's blocked. We've got to unblock it, figure out how to get past it, and 1 is not covered, so someone's got to write a test case. So those will be the actions we would take in a real project, and you can see this all in real time in the dashboard, plus the defects that are logged. And if I choose a project that's got more data, just to give you a flavor of it, this is not a healthcare one, this is a general one, you can see with a lot more data, you can really get to see how close you are, how far away you are from success. So going back into my healthcare project, if I want to generate documentation, that's also very useful. If I go into the reporting tab, I can go in here and say, well, I need to generate a requirements traceability matrix. Now, today I might do that by going through our MS Word document, an Excel sheet, and generating that by hand. However, here's what I can do. I can go into my traceability report. I can choose the format I want, choose what elements to include, filter it appropriately, and either save the report for the future or just run it now. If I run it now, I can generate my requirements traceability matrix right here from the system. So that's excellent. So documents that you need, like traceability reports, test reports, audit reports, those can all be generated from the system. Similarly, if you want to generate a report about the requirements in more detail, you can generate a requirements document, requirements detail report, and then you can generate that. And that will include a lot more information than the simple table we saw in the traceability matrix. It will generate the full document like this, where you can see all of the requirements. You can see not only the requirement, but you can see the changes that were made, for example. So you can see our requirement was approved. You can see what changes we made to it. You can see the tests that were run, this one here, and the defects that were logged. So it gives you a view of the requirements and the tests all together in one nice consolidated document. So that's the reporting side of things. In addition to the dashboards, you've also got reports where you can see other metrics. For example, if you wanted to see the defects being logged over time or the testing done over time, you can see it right here. And so we have these different graphs. You can see the test run progress, the test case progress, and various graphs. You can export the data, and you can export it to a spreadsheet as well. In addition to the time graphs, you might want to just look at the requirements and see by priority and status. So you want to slice them in a certain way. The test cases, you want to see what's passed, what's failed, maybe by priority, by tester. I don't know if we have any. I don't think we set any testers, any priorities. We'll do it by type instead. So you can see we have functional tests. One's blocked, one's failed. Flip it on its head like that. So there's different options of way of displaying the data. So as well as the graphs and charts and reports, you can also generate custom reports using our SQL writer as well. So obviously we've thought of a lot of graphs and charts, but we want to thought of everything. There are tools inside of SPiraTeam to write custom reports. So you can do that by going into the edit graph system. You just go into administration as a super user, going in here. You can edit a graph or create a graph, and using our SQL language, you can create the graph, display the data grid behind it, preview it, and then publish it. In this case, we only have one piece of data, so we only have one defect, but we can still add the graph just to show you. If you add the graph as a custom graph, it's now available like that. So anything you write in SQL, you can publish for your team. So that way, if there are specific graphs and metrics that your team needs or you need for compliance or reporting, you can generate those. Similarly, if you look at our requirements detail report that we shared and you say, you know what, we don't want to show the auditors all this stuff here, that's way too much detail, you can go into the reporting system, create a copy of our report, change the name of it, and then remove those pieces. So you can customize the reports as well. Or maybe this one, maybe you don't want to have some of the fields or change what's displayed. That's, again, very easy to do. So whatever tool you choose, make sure it has adequate reporting for your needs. So that's an overview of SPiraTeam. The last thing I wanted to show you quickly was some test automation. We talked about automated testing. Obviously, that's something that's a whole different topic on its own. We have some other webinars where we'll go into detail on how you do automation. But whenever you have a situation like that example, where you want to verify data loaded into a system, maybe you have 100,000 records. Having someone go through 100,000 records, and eyeballing them is not very good use of time. It's very laborious. Good chance they're going to miss errors. It's unlikely they're going to find any errors with that much data, just the fatigue factor. And so an automation tool like Rapise that we have here is a great tool. So just to show you what it can do, we've got a sample website. It's not healthcare related, it's just a general website, but just to show you, using an automation tool, you can go into Rapise and you can go ahead and record a test. For example, like this, you can log into it. There we go, and you can log in, and as I record my actions, it's going to build a test case for me, and I can then save this back into SPiraTeam and then make this part of my standard regression suite. Or if it was the case of data loading, I could use it just one time to verify the data loading, and then that's never run again. So depending on the type of test, it could be because you're running it frequently or because it's very heavily data dependent and it's something that's much better for a human to do. Sorry, for a computer to do than a human to do. So in this case, I'm going to go create a book and I'll go and just do that. Let's go ahead and say Adam's book. Hit insert. Automating is one thing, but you also do want to verify the results. So I'm going to click on the verify option and verify my book was created correctly. And I'll do that. Okay. And I'm going to log out, clean up myself, hit finish. And in the automation script, there's my set of actions. These are my actions, the data I'm using, and I can now play that back. And you can edit the script in here. For example, if you click on something that you didn't mean to click on, which I did actually at the beginning, you can remove things that are unimportant. And everything you see here is actually based on an object on the page. And so if you expand these items, you'll see these are all the objects that were learned. And you can also build your test case by just dragging and dropping it like this. So I want to click on the login box again. You just drag it in here. So that way it's a great tool where you can actually build a test repository of objects on an application and then build out your automation script. And then to play it back, I'll just save my data, make sure my browser's ready, yep, and then just hit play. And let's go to Firefox so you can see it versus Chrome. And it will basically play it back. And when you're doing validation and testing, you'll typically want a mix of automated and manual tests. Automate what you can, and then things that don't make sense to automate. Humans, will find things that you just haven't thought of. There's a lot of areas in the system that maybe you can't automate, either because it's changing too fast, or because it's just going to take too long to write the script, and you don't have to run it that many times. So automation is really good for things that either are repetitive or frequent. And if it's one of those two things, that's a top priority for automation. If it's infrequent or complicated or changing, maybe it's something that you want to consider manual testing, but it's up to you. So that's an overview. And now we'll move into the Q&A. So we do have one question already. Do you have a template of the required fields for doing an import of requirements from Google Sheets? I don't have Google Sheets installed on this particular computer, the plugin that is. The add-in for Google Sheets should, if I remember correctly, have a color coding to show you what's required and what's optional from the standard fields. When you add the custom fields, depending on what you've made required in your system, in your instance of the system, they may be required or not. And if you have questions about that specific feature, please feel free to email our support team, support@inflectra.com, and they would answer that too. But I don't actually have that in front of me, I'm afraid. In terms of why SPiraTeam is different, is that there are very few tools. I mean, I don't know if there are any other tools on the market that can give you requirements management, test management, planning tools, and task and source code tracking that do all of that and also have support for the workflow and the electronic signatures and reporting. I believe there are tools in the market that can do some of those things. I do not believe there's any tools that can do all of those things, including the workflow, electronic signatures, and the audit trail. There are certainly tools in the market where you can assemble a tool with add-ons and extensions and pieces to get something like this, but I do not believe there's an out-of-the-box tool that can do this, or everything I've shown you today. But there are definitely some tools that can do some of this. So if your needs are not as sophisticated, if you just need a basic bug tracker or a basic requirements tool, there are certainly other tools that can do those pieces. So I would not say that it's unique for that. But definitely it depends on you, the scope of what you're trying to do. Okay, there's a question. Let me read it. Okay, it's 2 parts. Is it required to use SPiraTeam when using SPiraTest or the automated test tool, or can you use both in conjunction? Okay, so that's a great question. So first of all, SPiraTeam, which is the tool I've been showing today, and I showed you a little bit of the automation tool Rapise, SPiraTeam does include SPiraTest as part of it. SPiraTeam is basically a superset of SPiraTest. So SPiraTest has requirements management, test management, and bug tracking. It's actually got most of what I showed you today because I was focusing more on the testing side of. If you go into SPiraTeam, you also will notice you have a planning board, which is like an agile board. So let me go in and change the project. We have more data. So this is a planning board like that. That's something that's not in SPiraTest. So SPiraTeam specifically does have. I'm just going to mute the line that's a little loud. Okay. So SPiraTeam has things around agile planning. It has task management. Those are only in SPiraTeam. They're not in SPiraTest. So certainly if you wanted those features, you wanted the task management, the planning boards, the task management, the task boards like a Scrum board, a Kanban board, all of the source code integration. Those are not in SPiraTest. They're only in SPiraTeam. If you want just requirements test and bug tracking, SPiraTest will suffice. Then the second part was, or can you use Rapise in conjunction? I think is the question. You can use Rapise in conjunction with any of the 3 Spira flavors. They're basically the same product, just different feature sets. SPiraTest is the smallest. It's basically for managing a QA team side of things. SPiraTeam is more elaborate. It includes the development side of it, so a whole project team, all disciplines. SPiraPlan includes everything in SPiraTeam, but also includes some program management and tools to help you manage many, many projects together. So if you're managing a project, as a project manager, SPiraTeam is appropriate. If you're the test manager, focusing just on testing, SPiraTest is better. If you're an enterprise program manager running hundreds of projects, you might want to consider SPiraPlan. Whichever of those 3 you choose, Rapise will integrate with them, and Rapise itself can be used with the 3 Spiras, or it can be used independently. So we have customers that use Rapise completely separately with Visual Studio Team System, for example, because that's what they use for their project management. And we have customers that use any of the 3 Spiras with other automation tools. Specifically because maybe Rapise can't test that application. So for example, Rapise can't test SAP, but it can test very well Dynamics. So if you're using Microsoft Dynamics, you'll use Rapise. If you're using SAP, you'll use something else. So those other tools do integrate with SPiraTeam and Plan and Test, and we have plugins on our website for those. Okay, so that was the general question. Now the second part was, we currently use ServiceNow for ticket management, so we're looking for a way to tie that with just SPiraTeam and Rapise. SPiraTeam includes all of test, and it includes Rapise. Sorry, it integrates with Rapise. We are actually going to be adding this year integration with ServiceNow for incident management and ticket management. So that's actually a feature we're going to be adding. We've got some customers who are asking for that. It's next on our roadmap. We just integrated SPiraTeam with version 1. We just integrated it with what's it called? WorkSoft Certify. And the next one on our list is actually ServiceNow and actually GitHub. They're 2 next. Okay, next question. David Martin. Are you a cloud solution or an on-premise solution or both? Both is the answer. SPiraTeam is a cloud solution and it's on-premise. You can have one or the other, and you can even switch between them because they are identical functionality-wise. And our licensing is based on concurrent users. All of our licensing is unlimited named users. And if I just go to our website and you do go to pricing, and you go to SPiraTeam, you can choose between cloud hosted right here and download right here. You can compare the 2. And if you look at any of the licenses, you'll see, for example, we'll do 10 users. What that really means is 10 concurrent users, unlimited name users and projects. So you could have a company with 100 people, but maybe there's 8 testers and 2 people who want to periodically go into the system and run reports. You don't necessarily, you have 8 testers and you want up to 2 people to log in simultaneously to run reports. So maybe 20 or 30 people could be doing that, just not all at once. 10 users will probably be sufficient. 8 of those 10 will be used on a more permanent basis by most of the users. The other 2 will be essentially used on a sporadic basis. That way, if you have 100 people wanting to run reports, you don't need 100 licenses just because they might run one report once a month, for example. So we do base everything on concurrent users to make it easier to plan for that kind of scenario. Okay, question from Mary Jo Clemens. If you have requirements in release 1 and then you create release 2, do you need to have all the relevant requirements in both releases? How do you do that? Okay. When it comes to requirements, that's a great question. When it comes to requirements, you actually associate, at least currently, the requirement with the release that feature is developed in. So it's like, for example, this requirement, which is the ability to add new books to the system, that's tied to release 1, in this case, actually release 1 and sprint 1, for example. Now, that same requirement will be testable in sprint 2, sprint 3, release 1.2, all future ones. So what you'll do is, although the requirement itself is tied to just one release, which is the initial release when it's first available, the test cases that test it, so there's a couple of them, this one here, for example, this test case would itself be linked to multiple releases, all the releases that the requirement can be tested in. So that's the difference. The requirements tag with the release when the functionality was built, and then the test cases will tie to all of the releases that it can be tested in. So it's slightly different. Okay, next one. For your patient demographic example, why not make each demographic data a separate requirement or a child of the main one? Great question. Why did I not do that? Maybe just to save time. So if you go back to my original project that I was working in, what I did is I created one requirement called patient demographic data. Sorry, that's test cases. And what I could have done, and I probably should have done, I'll be honest, is I should have created a child requirement for each of these. The reason why is that, let's say that the name entry tested correctly, the date of birth entry tested correctly, but only the SSN was the problem with the obscuring issue. Because I used one requirement, and when I failed it, I can't distinguish very clearly which of these failed. So really it depends. If your requirement is truly this whole thing, and if any of the bits fail, the whole thing fails, then maybe having one requirement makes sense. If you want to be able to know which of these 3 separately failed, having 3 separate test cases is more important, and having 3 child test cases, 3 child requirements, would be appropriate. And to do that, I could have gone in here and created, 3 children of this one. The primary reason I didn't do it was mainly just to save time in the demo. I didn't want to waste time having you watch me do that. Next question, David Martin. Does Rapise support mobile testing? Yes, it supports mobile testing, iOS and Android. It supports it with both physical devices and simulated devices and cloud devices. We do integrate with several cloud networks, Cobaton, Source Labs, and BrowserStack. So if you have your own mobile device network, you can do it already. If you don't have one, you can even use a cloud environment. And Rapise will report its results back into Spira from that. Okay, next question. Can tests be modularized? Can you call tests from other tests? Yes, you can. I didn't do that again just because of timing in the demo. I only have about an hour to do this whole thing. So I wanted to be respectful of your time. So I unfortunately didn't show that, but I will show you one we did earlier. If you go into the sample project and you go to a test case, let's go into a test case here, the ability to create a new book. If you look at it, you'll see we've actually composed the test case of other test cases. So this test case has 5 steps. The very first step is the ability to log into the system. We made that from other test cases that already existed, and we even are able to pass parameter values from the parent test case through to the child test case. So to answer Dave Martin's question, you can modularize it by, this is an example of a module that we've called into our test case, and then we're calling it with different parameters. So I could use it in another test case with a different login and password, for example. Okay, next question. Francesca, thank you. If I execute a test and then it gets until verified status, and then I have to perform it again within another release, how will the status of the test case be updated? Will another version of the test case be created? Yes, if you add it to release 1, okay, let me show you, maybe it'll be easier. So yes, if you go into this healthcare validation project, And if you notice, it shows right now that that test failed. Now, if I look at release 1, it failed also because it's in release 1 and it failed. If I go to release 2, it actually isn't even listed because it's not actually in that release. But let's say we go back to all releases and I add that test case to that release. So what we're saying is, I ran this test in release 1, it failed. This needs to be retested in release 2. But if I go to release 1, it's failed. The question is, what does it look like in release 2? Not run, because it hasn't ever been run. So it's not another version of the test case. It's the same test case. It doesn't need to be another version yet. It has been basically not run in release 2 ever. So the result is whatever it would have run in, which in this case is not run. If you run it in release 2 and it passed, and you went back to release 1, it would still be failed, because even though you've passed it in release 2, there's no guarantee that you actually have passed it in release 1. The functionality may be different. You haven't necessarily generated a regression fix to push back into release 1 until you've tested it. So we don't create another version of the test case itself. What we do, though, is we do keep a different version of the test result, what we call a test run. And if you look here, you'll see there's a test run. It was run against release 1. There's no result against release 2. If I actually go in here now and I do decide to run it against release 2 deliberately, hit next, and I'll just pass all. So I pass the 2 steps, hit finish, go back to OK. You'll see you now have it passed. So it passed, great. Did it pass in release 1? No, it still failed. So that's really important. We do keep the results separate. If you go to the test run, now you can see passed in release 2, failed in release 1. Thanks for watching today's webinar. If you'd like to learn more about software testing, validation, and healthcare life science validation, please subscribe to our YouTube channel. Have a great day.